Good evening, everybody. Thank you for joining us tonight for the Viva Learning webinar. I'm Dr. Les Rikas. So who is this Les guy anyway? Well, if you go back to 1966 at the age of 10 months, this is my brother's idea of who I should be. But I'm going to give you a little bit of background on me. I'm born and raised in Winnipeg, Manitoba, graduated in 1990 from the University of Manitoba Faculty of Dentistry here in Winnipeg. In 1995, I founded the Linden Market Dental Center, where I currently work and play. I attained an associate fellowship in laser dentistry in 2007 from the World Clinical Laser Institute. And I am a graduate and mentor at the National Institute for Dental Learning. My mentors as well are Dr. Ross and Deborah Nash. I did that from 2008 to 2012. Something that is near and dear to my heart. I was inducted as a member of the American Society for Dental Aesthetics. That was by Dr. Irwin Smigel, who is widely known as the father of aesthetic dentistry. And that was back in 2012. And I attained a fellowship in the International Academy for Dental Facial Aesthetics by Dr. George Friedman, again in 2012. Another fellowship in the American Society for Dental Aesthetics in 2017. And I'm a board certified cosmetic dentist. This is the specialist of aesthetic dentistry. And I attained a fellowship in the International College of Dentists in 2021. And I'm also the current aesthetic and cosmetic editor of Oral Health Dental Journal here in Canada. I've been doing that since 2015. I'm also the past president of Alpha Omega Dental Fraternity, as well as a member of the Canadian Dental Association, Manitoba Dental Association, and Winnipeg Dental Society, Seattle Study Club, and Alpha Omega. Just want to let everybody know this lecture is sponsored by SDI, Southern Dental Industries. I will only be presenting SDI products that I use on a daily basis in my office. While this lecture discusses SDI products, it is 100% backed by my clinical judgment and usage. So I had a really great experience back in, let me just turn down the volume here. Back in about a year ago, the CDLI, the Canadian Dental Laser Institute, provided an opportunity for me to do a lecture with them in Jamaica. And here we are on the beach in Jamaica giving a lecture, a little bit of a different backdrop for sure. And we had a blast. Here is Dr. Marina Polonsky, who is the chief curator of the Canadian Dental Laser Institute, doing her thing as well. And we had a blast on the beach. It was completely different. Everybody was totally relaxed. Maybe a couple of people fell asleep, but all in all, a great time was had by all. And after the lectures, we then went to the beach and had a little bit of fun. Here is my information. Please take a moment to take note of my information. If you ever have any questions, please feel free to email me and I will get back to you as soon as I can. Just want to let everybody know that during this lecture, there's a couple of times that I have some videos in there just to break the monotony, and we'll be doing that. So here's my first one. I like to call this Monday morning, 8 o'clock.
Yeah, don't try and talk when my hands are in your mouth, sir. My wife and I are thinking of going abroad this year. Dudley, she's got family in the zoo over there. You got kids? Please don't talk when my hands are in your mouth, sir. Could do with a fill-in here, actually, at the back. Is it mainly bananas you eat? I won't tell you again, sir. Please don't try and speak when I'm working inside your mouth. Right, I'm just going to have a cheeky little taste. That's not bad, actually. You know what's done? Just need to smell your breath. Oh, God, that is rank. I think I need to lie down. Oh, God.
Today's topic, we're going to discuss Game Changers, a review of my favorite dental restorative materials. Today's lecture outline, we're going to talk about why I use these products on a daily basis. I like to call that the it factor. How do I evaluate any type of dental products that cross by my desk, whether it's materials or instruments? What is the value of these products to me? And we're going to go through some product presentations. At the end of all that, we'll go through some questions. If you have any, please, you'll be able to go into the chat room and ask the questions, or into the Q&A section. I, as an educator, am not drawn to words as much as actions. It's pretty meaningful to me. I'm a show me kind of guy. However, don't believe everything you see on Facebook. I just saw this not too long ago, and obviously this is untrue. And it goes back to the it factor, actually. What is it about products that grab my attention? Comes down to 5 simple questions that I've decided that are meaningful to me. Do I need it? Do I understand it? Can I use it? Can I repeat it? But the biggest question of all is, do I love it? So through that product evaluation, the it factor is essentially a template to evaluate all products. How many dentists have cupboards of old expired materials? I call that the cupboard of despair. I have one in my office as well. Product after product, we use it, we abandon it, and for some reason we store it indefinitely, like that expiry date is just going to stop. Well, I try to minimize this. Again, it comes down to these 5 questions. Do I need it? Do I understand it? Can I use it? Can I repeat it? And do I love it? So first question, do I need it? All dentists need to evolve with time. Therefore, as new products come, we need to figure out if we need to add them into our practice. Just because we go to a meeting and we're on the trade show floor and there's all these shiny new things doesn't mean we have to use them. It doesn't mean that it's worth our while to buy them. Do I understand it? I'm a bit of a freak in that way. I trust my rep. I listen to their infomercial. We talk about compressive strengths and shrinkage, et cetera, et cetera. It's like dental materials all over again. The funny thing is, when I was in dental school, dental materials was my nemesis. I hated it. But as I've gotten more and more involved with dentistry and different companies with their products, I realize how important it actually is. So I make sure I know every detail about how material works, how it handles. I play with the material on the bench top. I'll check curing times if applicable. I'll even check the depth of cure with little cylinders. They say it'll cure to 4 millimeters. I want to check that because every curing light is different. Maybe theirs cure all the way deep to 4, but what if yours only cures 2? You got to check the handling in my hands as well. Can I use it? We are all creatures of habit, unwilling and unwanting change of any kind. Therefore, we are resistant to try new things. But if I do try something new, I want to know how it handles in my hands. Can I use the product? Once I have used the product outside the mouth, I have enough info to safely use the new product inside the mouth. I don't want to use that first patient as a guinea pig. I want to make sure that I know how it works and get the job done. Can I repeat it? How do these products perform in the oral cavity of my hands? Does it handle the same? Do the setting times change inside the mouth? They probably do. Is the product more or less sticky inside the mouth? Is the final result repeatable each time? Because I want stability. Here on the left-hand side, we have a restoration on tooth number 22. And essentially, we did a nice buildup on the right-hand side. But is it repeatable? Here we have another case where we're doing 4 chairside veneers on teeth 13, 12, 11, and 23, or 6, 7, 8, and 11. On the right-hand side, we have the finished product. And we're going to talk about this case in depth later on, but I think that it's pretty repeatable, and I think that the product performed wonderfully. But the final question, do I love it? That's the one that really grabs my attention. Do I love it enough to change what I'm currently using? Does it make that much of a difference? There are many factors involved in loving a product. Has it been easy to use? How steep is the learning curve, and is it worth the curve? Can I use this product for many different applications? What's the shelf life? If you're going to pigeonhole a product, you're going to get it and it's only good for one thing, how often are you going to use that product? You better check the shelf life, because you may not even get to use the product and it's already expired. And best of all, did the end justify the means? Well, here we go. I did a build-up on tooth 22 on this 16-year-old girl. If I take a look at the right side final photo, it looks a little bit dark to me. However, this was right after desiccating all the teeth while doing the build-up. We brought her back. This is what does it for me. When I take a look at her smile, it looks absolutely perfect. And that justifies things for me. Here's a little video that I'm gonna show you, a little clip right now. It's from a cruise that I took with my father-in-law, and we were sitting down for lunch one day, and he pulls out something from his mouth and literally sticks it right in my face. And I take a look, and it's a piece of porcelain, because he smiles, and that's what I see. I like to call him Hillbilly Jack. Well, I went down to the belly of the ship, and there was no dental office there, and we're at sea for 2 more days. We ended up, our first landing point is Cartagena, and we found a clinic. It was a medical dental clinic, not really much of either, actually, but they allowed us to pay our way into the clinic to use their materials. And boy, that was pretty interesting. They didn't speak English. I didn't speak Spanish, but we managed to muddle through, because, you know, if you put an O at the end of acid, it becomes aceto. And right away, they knew what I was talking about, took me to their fridge, and nothing resembled any of the materials that I know from North America. It was a guess, really, taking 2 bottles, mixing them together, and somehow managed to split that crown back together for the duration of the trip, to the point that I actually had to cut it off when we got back to my clinic. And here's a little bit of comic relief. There I am laughing because I'm spraying water in his mouth in a third world country. I have no idea where that water comes from, whether it's safe to drink. But I said to him at that point, well, I guess we'll find out later if you're okay. These are my 2 wonderful dental assistants from Cartagena. It was a wonderful experience, but it really, really shows me how lucky I am to be practicing in North America and how difficult it is to do it in other parts of the world. Let's go through some product presentations. First product we're going to talk about is Riva Bond LC. It's one of the bonding agents that I use routinely in my dental office. The protocol is quite simple. You total etch for 15 seconds. You rinse thoroughly, wick dry, leaving a moist surface. You're going to tap the capsule on the counter. Then you're going to activate the plunger, and you're going to mix it for 10 seconds in a triturator. You're going to puncture the foil end with the microbrush, give it a little stir to make sure that the powder is completely mixed, and then you're going to apply several thin coats to the surface and lightly air thin. Sounds familiar, right? And then you're going to light cure it for 10 seconds. Here we are. We've isolated the adjacent tooth with plumber's tape. It's one of the most efficient things that I use to make sure I don't contaminate the adjacent surface. And I'm going to bond right next to it. So I'm total etching for 15 seconds. I rinse thoroughly. I lightly dry or wick it, leaving a moist surface. Here is the cartridge. We're going to tap the flat end on the counter. Then we're going to push the plunger in and then stick that into the triturator. So we're going to tap, activate, and mix. Here we are stirring with the microbrush, and we're going to apply it to the etched surface. We'll put an application of several layers of bond, and then we will air thin it. Give it a 10-second cure. And now we're ready to layer our composite. So what is the value of this product for me? When I talk about value, I talk about the first thing is trust. The more I use the product, the greater degree of trust. I think it's probably the same for most people. Number 2, ease of use. The more steps, the more time consuming, and the greater the ability to incorporate human error. So really how easy it was to use. Human error are things like uneven drops, not mixing thoroughly, not waiting the required time in between coats. Rivabond LC takes all this into consideration, eliminating the human factor. We activate it, we mix it, we puncture the end, we give it a little stir, and we apply several layers. It's very simple. Reliability. That comes down to failures. Every product will have failures, but knowing the product decreases the failure rate. I'm happy to say my Rivabond failure rate, one anterior in the last 6 months. And I think that's pretty reliable. Sensitivity. How much post-operative sensitivity is there to deal with? Is it too excessive? Is it more than the last bonding agent you used? Is there a way to prevent it? But the biggest question for me is, am I using the product correctly? Because I do believe that a lot of times failure comes down to not using the product correctly, not going through the instructions and following the letter of those instructions. Dentists must bear some of the responsibility in that. Let's move on to Aura Easy. This is an ultra universal restorative product from SDI. The characteristics are that it is really simple to use. It's Aura Easy. It's that ultra universal restorative product. It's very versatile. You can use it in the anterior or posterior. It has easy shade selection. There are only 4 shades: A1, A2, A3, and A4. So really, if the material fits the bill for the shade that you need, it's terrific and it handles well. Here we are going through the shade selection process. We're going to use our super etch after we have put on the plumber's tape. We'll use our Rivabond LC. There is our buildup. And on the right is our final restoration. It looks nice. I liked it. The material works well, but do I love it? Well, here's how I prefer to use Aura Easy. I use it in the posterior only. I think it's a wonderful product for posterior use, and it's quite simple. Even though, yes, I can spend an hour doing a posterior composite where I can add in translucency on the occlusal surface, honestly, who's going to be looking at that? Not our patients, and then certainly I'm not. I want it to blend in well with the tooth, and that's what we did. So there's our final restoration, and it blends in quite nicely. And again, posterior usage in my practice. Why? Because I prefer a layering system. I'm a cosmetic dentist. I believe in building up a tooth to look like the adjacent tooth and to mimic the aesthetics of the tooth that I'm working on. Either a 2 or 3 layer system works best in my hands. It mimics the aesthetics of a natural tooth. Two layers, an opaquer dentin, and maybe a clearer frosty enamel, or 1 layer of dentin and 1 layer of enamel like Aura. So for me, Aura Easy really is just too easy, because in my life, I love to complicate things. So I prefer Aura. Here we have a slide from SDI, and it says 8 dentin shades, 3 enamel shades, 0 guesswork. Well, I can tell you right now, 0 guesswork is not exactly true, but I'm going to talk about that later on. Aura is the modern microfill that combines a new low shrinkage resin composition with a unique morphology of ultra high density filler. And this provides us with the exceptional strength that we need to withstand the occlusal forces. Plus, it gives us the polishability and the handling that we need. So what am I looking for? I'm looking for longevity, strength. Aura has very impressive compressive strength, about 370 megapascal. And if you compare that to Tetric EvoCeram or Ceram X Mono or Gradia Direct, Aura outperforms them. And it also has a very high flexural strength. I believe it's about 136 megapascal. So with the flexural strength, you can be sure that it's going to withstand the flexing of the material and not break down. Ease of use. Here we are taking the shade selection for Aura. We do a dentin shade from the gingival and an incisal shade from the incisal edge, the enamel shade from the incisal edge. Polishability. On the left-hand side, we have a fractured central. We've built it up. Polish is very, very nice, and the final product is wonderful. Repeatability. Here we had two flattened screwdriver teeth with a diastema in the central. It turned out quite nicely, and it was repeatable. Dentin shade selection again from the gingival portion, the enamel shade from the incisal portion, and that is the protocol for taking shade. And then we'll prep the tooth, we'll etch the tooth, bond, we'll put on our dentin layer first. And with Aura, I do want to mention that the dentin layer is the thickest shade. When you're using an opaquer, the opaquer layer is a very, very thin shade. But in this particular case, the dentin layer is thicker and the enamel shade is thinner. And there we are putting on our enamel shade. And then we're going to finish it, polish it, and there's our final result. Blends in quite nicely. Let's go on to Luna, another wonderful restorative product. And again, I use that in my office on a daily basis. Why? It's a nanohybrid technology. The filler particle size affects the aesthetic and mechanical properties of composites. Luna contains a hybrid of nano and micron-sized particles to achieve optimal aesthetics and strength. That means the polishability is going to be great. It means that the material is going to stand up to the occlusal load over time. So what am I looking for? Again, longevity. I'm looking for strength. Luna has a filler load of 77% by weight, and it has a very impressive compressive strength of 343 megapascals. If we're talking about this in terms of the old PBM crowns that I used to use routinely, that has about 78 megapascals of compressive strength. Here, Luna shows us 343. Gets high marks for flexural strength as well, which means that you can use it in class 1 and class 2 situations in very high stress bearing areas like marginal ridges, and it's going to withstand the test. Flexural strength is at 136 megapascals. Ease of use. Left-hand side, we have a broken down lower central, then we've repaired it on the right-hand side. Polishability. When we can blend in a filling and it just disappears beyond the finish line, we know we've done something right. And we're also using the correct materials. Versatility. We could use Luna in the anterior and we could use Luna in the posterior and get equally wonderful results. Repeatability. Can I use it on adjacent teeth and just have the same result each time? Luna protocol for shade selection. It's got an extensive shade range. Luna is available in 13 universal shades, A1, A2, A3, A3.5, A4, B1, B2, B3, C1, C2, C3, D2, and D3. Luna is also available in specialty shades. Dentin shades of OA2, OA3, and OA3.5. It comes in bleach shades as well as incisal shades. So really, for doing any type of cosmetic work, it allows you to blend a tremendous variety of different situations. So here we're going to prep the tooth, give it a nice long bevel. We've isolated with plumber's tape so we can keep from bonding the teeth together, as we're going to use the body mopper method to bond right up against that tooth once we remove the tape. Then we're going to add our Riva Bond LC. Now we're putting in our opaque light, and contrary to what we did with Aura, our opaque shade is going to be a very, very, very thin layer, and it's going to block out the light from the oral cavity. And here we are putting our enamel shade on. Then we're going to trim, finish, and polish. There's our final shade. And we're going to replicate that again on the adjacent tooth. So if you like Luna, presenting Luna 2, new from SDI. It has definitely gotten even better than Luna. Luna 2 is the next generation Luna Universal Composite. It has an improved unique blend of fillers that were researched and developed by SDI to deliver the enhanced handling, very high radiopacity, and a reliable mechanical properties. Luna 2 is BPA-free for health-conscious patients. And in relation to Luna, it is actually fluoride releasing, whereas Luna is not. Here we have Luna versus Luna 2. What's changed? Again, BPA free. It has radiopacity of 250%. And again, fluoride releasing. Those are the three major things. We could talk about compressive strength being a little bit more and flexural strength being a little bit more, but it's very, very similar. Luna 2 has a combination of ultrafine fillers, resulting in an exceptional universal composite with superior handling, reliable mechanical properties, and excellent aesthetics. It has a very high compressive strength at 360 megapascals, and that supports the occlusal load. And it has fantastic handling. Luna 2 is creamy while it has been sculpted and holds its shape. A very high radiopacity, BPA-free, and it has the logical shade matching technology, which essentially is the chameleon effect. You could be off just slightly in your shade, and it is going to pick up the color from the adjacent tooth. And it's very color stable, and it has a great long-lasting polish. So what am I looking for? Again, we're looking for strength. Superior compressive strength that has a compressive strength of 360 compared to Luna's 343 megapascals. Most mastication forces are compressive in nature, making this an important mechanical property for posterior restorations. It has high flexural strength as well at 130 megapascals. Luna 2 withstands masticatory forces in a similar way to Dentin. This reduces failure risk either in areas of high stress as a class 5, or in less supported areas such as cusp replacement or proximal boxes. What am I looking for? Ease of use. Here we have a broken down central incisor, and on the right-hand side, we have the final product. Polishability. There we have our polished final result. Versatility. Again, we could use in the anterior or the posterior. And repeatability. 2 central incisors, both broken, both built up. Color looks great, so it's repeatable. When we talk about shade selection with Luna 2, it is faster, more accurate shade matching. Luna 2 offers the innovative, logical shade matching technology and chameleon effect for easier and precise shade selection. Shades were developed prioritizing value, the lightness, while pigments are arranged in a logically increasing way for simpler and faster match to a Vita classical shade guide. Patients will enjoy more accurate aesthetic results, including better polish and wear resistance. So here we are, we've done our prep, nice long bevel. We've protected the adjacent tooth with plumber's tape, and now we're going to etch. Now we're going to bond. We're going to do our very, very thin opaque shade, and then our thicker enamel shade. Now we're going to trim it, finish, and polish. And there's our final result. Blends in very nice. Patient is very happy. So what does all this mean for me? This gives me another weapon in my arsenal. The truth of the matter is you can't just have one material in your office and expect it to be the be all and end all for everything. You can use this material when you have difficult shade matching, because versatility is the key, and it gives me comfort in the driver's seat. Also new, LunaFlow and LunaFlow LV. With a blend of fillers and different ultrafine sizes to optimize handling, mechanical and optical properties, LunaFlow and LunaFlow LV offer precise control, consistent shade matching with color stability, and excellent strength and wear resistance. Luna flows on demand and it holds its shape for superior handling. LunaFlow and LunaFlow LV, they don't string. There's exceptional compressive strength, great flexural strength. Again, it has the chameleon effect. It also has fluoride release. It's great color stability, perfect for restorations and repairing provisionals or porcelain. And it has a very, very high radiopacity. Comes in the two viscosities, LunaFlow and a very flowable LunaFlow LV. And this is comparable to an improved over wave. If we take a look at Luna 2, LunaFlow, and LunaFlow LV, all have fantastic handling, all have very, very high flexural strength, very high compressive strength. The compressive strength of LunaFlow LV is the weakest of the three, and that's because it is quite flowable. The high radiopacity is existing in all. All three contain fluoride, and Luna 2 is BPA free as well. So LunaFlowable's characteristics, again, we're talking about strength. Radiopacity is that it's visible, very, very visible and identifiable in all X-rays. Flowability comes in the two viscosities, LunaFlow and LunaFlow LV. On the left, we show LunaFlow, and it's stackable. It will stay right where you put it. LunaFlow LV runs. If you put it on a paper and turn it vertically, it'll just run down the paper. So it depends what you want to use it for. I would use LunaFlow in a liner situation as a first layer. The shades, LunaFlow shades, are ideal for all anterior and posterior restorations. A1, A2, A3, A3.5, B1, B2, C2, opaque A2, opaque A3, and incisal shades. They also come in two bleaching shades, which are comparable to Vita shades OM1 and OM2. I use Flowable quite a bit in my office, actually, and this is a wonderful scenario when I could, number one, use it for a restoration. I use it in pediatrics as well, quite often. But when you can put it in place and manipulate it yourself rather than having it run away, it makes it quite easy to use. So versatility, you can use it in just about every type of restoration. Class 5 restorations, pit and fissure sealants, minimal class 1, 2, 3, and 4 restorations, radiopaque cavity liners, cervical abrasion and erosion lesions, abfraction lesions, implant seals and incisal abrasions, repair enamel defects, minor core buildups, temporary crowns, splinting mobile teeth. If you've ever used Ribond, this is the most efficient way of putting on Ribond to make a Ribond bridge or a splint. Restorations in deciduous teeth, repairing porcelain restorations, and to block out undercuts in inlays, onlays, and crown preps. Let's move on to some case presentations now. Here we are, this familiar slide that we had at the beginning. So this is for Aura. We're going to do direct composite veneers. For any Americans in the crowd, we have teeth 6, 7, 8, and 11. And for Canadians, teeth 13, 12, 11, and 23. So what are the issues? When we looked at that slide, you could see previous chairside veneers are chipping, peeling, and staining. She was looking for a much better color match. However, old crowns 9 and 10, and I'm going to go back to that. Old crowns 9 and 10, 21 and 22. The patient said that she is not going to be replacing. So overall, we wanted a balanced look to the anterior segment. gingival heights were uneven, we were contemplating doing a gingivectomy. So the treatment plan we decided was gingivectomy of teeth 12 and 20, 12 and 11, and or 7 and 8, chairside labial veneers on 6, 7, 8, and 11, 13, 12, 11, and 23. And we're also going to accept that those two crowns will not match the final result, not even in length. She wouldn't let me adjust the incisal edge. She wouldn't let me touch them at all because she was afraid that we were going to have to replace them right then and there. But we wanted to create an aesthetic environment for future replacement. So go into our protocol. We're going to do our shade selection. Actually, these next two slides are reversed. We should have taken the enamel shade, show the enamel shade first, taken from the incisal edge, and the dentin shade taken from the gingival third of the tooth. There's our slide for the enamel shade. And one of the things we notice, I'm going to go back. First of all, you see the enamel shade here. This is the darkest enamel shade for Aura. Not exactly the shade that I would use. And here's the dentin shade. Here we took a much darker dentin shade, and then we muted it with the enamel shade by varying the thickness. So that's at the beginning when I said it's so easy that you don't even know, zero guesswork. Well, there is some guesswork when you have to fiddle with the shades. And so my choice here was to use Aura. However, Luna 2 would be a much better option because you'll be able to match that shade pretty darn well without having to think about it. However, what happens when E3, that enamel shade, is too light? Here we chose a gingival shade which was slightly darker than the gingival third by design, as the enamel shade chosen is the darkest color available. And I've spoken to SDI about this, and they're working on making some darker enamel shades, and that'll solve everything. But this can be problematic. If the enamel layer is quite thin but thick enough that it will dull the chroma slightly of the darker shade, then that'll work. If unsure, lay the material on unbonded onto the tooth to check, and I'd call that the intro mock-up. So here we are. I've laid over the dentin shade followed by the enamel shade. I gave it a quick cure. It's not bonded on the tooth. And from here I can see, well, yeah, that looks okay. But as I get closer to the dentin shade and taking away some of the enamel thickness, it's going to show the color that much more. So it gives me a general idea of what the effect will be. Step 2, we did a laser gingivectomy. In my practice, I use a super topical anesthetic, which is a trifecta of anesthetics, and it's called TAC20 gel. And I'm going to do 2 3-minute applications. And you could use this for diodes or with hard and soft tissue lasers. We're going to probe after we've used the gel and sound to bone. And we want to know, is there enough tissue for a gingivectomy only, or do we need to remove some bone as well? Just checking out our biological width. Here we'll put on our super topical anesthetic to 2 3-minute applications. Here we're going to probe. Patient doesn't feel it at all. And we find that we have some redundant tissue there that we can cut away. So with my Waterlaze I+ from BioLaze, I am now tracing on the tissue my proposed finish lines. And that white area, just like chalk on a chalkboard, will go away very, very quickly. So I'm not damaging it at all. If we decide that we don't want to do the gingivectomy, we're not committed. So I'll draw it on the tissue. I'll step back, take a look at it from over top, and make sure that I like where those finish lines are going to be. Then we'll do our laser gingivectomy. On the right-hand side, you can see that the height of the gingiva is much better now on both 12 and 11. And now we're going to prep the teeth. Just like when we do porcelain veneers, we're going to use our depth cutter and go down 0.5 millimeter. Then we're going to take a pencil and I'm going to identify those depth cuts. And then I'm going to take out a chamfer burr and I am going to join all of those depth cuts and take a nice even reduction and place a very thin chamfer right at the gingival margin. Here we have our prepping complete. Now we're going to go ahead and isolate with our plumber's tape, our Teflon tape, and we're going to do a total etch because I'm going to use the Buddy Mopper technique to build this up. Now we're going to go ahead and we're going to bond it, and then we're going to cure it. And now we're going to start layering aura. This instrument that I'm using is from Ivoclar. It's called the Optrasculpt. If any of you are looking for probably the absolute finest composite placing instrument, the Optrasculpt is it. On the right-hand side, you can see there's that I'm choosing to use a little pad. I use that 99% of the time because it allows me to move the composite freely without incorporating any air bubbles or folds into the material. And it allows me to get a nice even layer there. It does come in two other tips as well. I think one of them is a point to tell you that I don't even use them. I use that the majority of the time. Here we're putting our enamel shade over top, and on the right-hand side, our buildup is complete. Now we're ready to trim and finish. We'll take out our ET burrs, do a little contouring, then take out our Softflex discs or our Shofu discs. Here we are polishing with an enhanced wheel, and then we're going to use our groovy points to polish it up. And there we have the restoration on number 11 or number 8 completed. As you can see, the incisal ledge is not as long because that's dictated by her occlusion. I wanted to shorten the incisal edge on the crown on the 21, but I cannot do that. She wouldn't let me. And here we have a fast forward to all four restorations complete. The crowns look horrible, but if you compare the restorations to the mandibular teeth, everything looks fantastic. Let's go on with a case presentation with Luna. Here we have fractured tooth 2-1, incisal edge, tooth number 9. And as said before, Luna provides me another weapon in my arsenal, especially if I'm having trouble matching the shade. It's a 2 or 3 layer process using an opaque shade to 100% block the light coming from behind the tooth in the oral cavity. That's that darkness that shows up if you're not using an opaquer, followed by the enamel shade. Here I chose opaque A2 for my opaque shade and A3 for my enamel shade. Here we are placing a nice long bevel. We've isolated with plumber's tape, and we're going to etch it, and we're going to bond. And we're going to put on a very, very thin opaque layer. And then our much thicker enamel shade. And here we are with our overbuilt restoration. And now we're going to go ahead, finish, and polish. We're going to trim it up, do some finishing with our enhanced cup and our groovy points, groovy wheel. And there's our final restoration. Blends in quite nicely. Again, if I were to go and use Aura for this, I'm going to have to guess just a little bit more if that enamel shade is too light. And I believe here it was, and that's the reason we went and used Luna. Let's move on and do a presentation of Luna 2. Again, a simple fractured central incisor, tooth number 11 or number 8. As said before, I prefer layering my composite with 2 or 3 different layers. And Luna 2 provides very easy shade matching due to its chameleon effect. I'm going to use the 2 to 3 layer process using an opaque shade to block the light from the oral cavity, followed by the enamel shade. And here I chose opaque A2 for my opaque shade and A2 for the enamel shade. So we'll do our prep and give us a nice long bevel on both the labial and the lingual surface. We're going to etch it. Then we're going to apply our bonding agent. We're going to make our lingual shelf, and we're going to build it right up against the adjacent tooth because we haven't etched it, we haven't put bonding agent on there, and we can put that very, very thin shelf and then be able to separate the teeth, no problem. So there's our lingual built up, a very thin layer of opaquer. And now we're going to take my favorite instrument to use, a beaver tail, and I'll just wedge those two teeth apart very gently. And you'll hear a click, and you know it's now debonded. Then we're going to layer it with our thicker shade, our enamel shade. And here's our buildup complete. Again, overbuilt, so we can trim it down to size. We're going to use our rotary instruments. We're going to use our discs. And I'm also using a number 12 scalpel blade, which I always use to trim the excess flash from my restorations. I want to make mention of one product that has received tremendous accolades recently, and it was introduced to me. It's the Cut Composite Polishing System from Dental Savings Club here in Canada, and I believe that they have they are being sold in the States as well. But this Cut Ultimate Embellish Posterior Composite Kit gives you a absolute wonderful, highly polished surface, and I believe that it is one of the best out there, certainly the best that I've ever used. Here we are with the blue wheel, and then followed by the pink wheel, and then our groovy points. And there's our final restoration. Right after we've done the restoration, the tooth is a little bit lighter, but the filling was matched beforehand. And now we're going to do our final case presentation on LunaFlow. Here we have two central incisors with carious lesions right at the gingiva. In my office, whether all cervical lesions are at the level of gingival crest or subgingival, they will undergo a minor laser gingivectomy with my Waterlays I+, with either or that with it or the diode. And we're going to get the cervical caries removed with our hard tissue laser, the Waterlays I+. Then the area is going to be smoothed again with a faster speed of the firing of our laser for an optimal bonding surface. It leaves it frosty white, just like it does with etchant. Now, if you listen to BioLays, they say you do not need to use bonding agent. I routinely use bonding agent. One of the things that's a little bit different about using the Waterlays I+ is it is not cutting the tooth. It's almost melting the tooth. And because of that, you're not getting the same micro tags that you would when you're just etching a dentin surface. So using a material that is universal bonding will be fantastic, or quite a few layers of regular bonding agent. We're going to bevel the enamel, and we're going to restore the caries. And the advantage of using the lasers at 98% of the time, I don't have to use any anesthetic unless the patient requests, and there is no bleeding. So here we are doing our gingivectomy. We're exposing the entire lesion, and we're going to remove the caries again with our laser. Patient is not anesthetized. All they're feeling is maybe a little bit of cold, maybe tingling, and maybe a little bit of pressure. And now we're going to bevel the enamel, and then we're ready to restore. You can see the nice frosty surface on there. So we're going to etch it, and then we're going to bond. Here we are dispensing the LunaFlow on the left-hand side, and you can see how it's not flowing. It's staying right where it is. Very nicely stackable. And what my choice is to manipulate the flowable material is just a simple Explorer, Shepherd's Hook Explorer. Don't waste your money buying a specific instrument to move your flowable material. An Explorer works just fine. And here we are curing it. Then we're going to trim, we're going to finish, and we're going to polish. And there's our final restorations. The only bleeding you see there, a little bit of irritation on tooth number 9, and that's from the finishing process. So, in summary, Riva Bond LC, we've talked about. We've talked about Aura Easy, Aura, Luna 2, and Luna Flow, and Luna Flow LV. Start off with Riva Bond LC. It's excellent bond strength with very few failures. Aura Easy, I recommend for posterior usage only if you're going to use it because of its limited shade range. Aura is a premium anterior composite for great aesthetic restorative work, but I don't use it in the posterior, but you can. Luna 2 and Luna, great shade ranges and should be used in all restorative procedures. Luna 2 is fluoride releasing as well. Luna Flow and Luna Flow LV are strong, they're versatile, they can be used in all restoration classifications, they release fluoride, they're radiopaque, and they come in those two viscosities. Well, I just want to thank you guys all very, very much. I want you to stay safe and please be good to each other. We're going to take questions now. I'm just looking at our questions right now. Okay, Sophie. So when you have only the 4 shades for Aura Easy, what do you do? That's why you can't just have one material in your office. If they don't match, you can't use it. You have to use another material. Samantha, any plumber's tape will use. You can use any plumber's tape. Go to your local hardware store, buy a nice big bulk pack of it, and you'll use it forever. Gordon, yes, if you slightly over reduce your composite, what I would use is bonding agent over top. Don't cure the bonding agent, add your next layer and then cure it, and you are adding your more composite to your restoration. Are there any more questions? Well, again, thank you all very much. Thank you for spending an hour with us, just slightly short of an hour. I hope I've given you all something to think about, and I look forward to hopefully seeing you all again.